we talk about this a lot, like someone walks in and we're not trying to immediately be like, okay, you know, this is someone, you know, a weight loss issue or a shoulder issue or something like that. It's like we want to know them as a person.
The thing is, like, we need to learn who they are, and then we need to listen to, you know, what kind of language they're using. So just try to get the hint from that. So pay attention to what they're saying and listen to them more.
I really, really appreciate you being here, and thank you for coming again.
Thank you.
For the second
you.
time.
Yeah.
For the
Yeah.
second time,
Yeah.
Travis and Kaori.
Yeah.
And you've got a new addition to your family.
Yes.
Yes.
I've seen it posted.
Yes.
I've seen her post it. What's her name?
Chai.
Chai.
Yeah.
And what kind of dog is she?
She's a Jack Russell Terrier.
Jack Russell Terrier.
Yeah.
And she is just some little character, isn't she?
Oh, she is. Yeah.
You're talking about how she sleeps and stuff like that. Anyway, let's get into what you do.
Okay.
Your company name,
Kinetikos.
Kinetikos. And tell me what it's like. What's the first thing you look for a patient when a patient comes in? Our client. What's the first thing that you look at?
So Kinetikos is the company which mainly like run online education for professionals.
Okay.
But we also have the facility named Kinetikos Lab,
Right.
and then that's where we actually have people coming in.
Okay.
Yeah.
And when they come in, what do you look for? What do you think about?
The first thing we look for is just, more than anything, just trying to understand them as an individual, like why they're really there
Yeah.
and what they're about. You know, it's not, we talk about this a lot, like someone walks in and we're not trying to immediately be like, okay, you know, this is someone, you know, a weight loss issue or a shoulder issue or something like that. It's like we want to know them as a person, because
Yeah.
at the end of the day, they're a living, breathing human being.
Right.
They might have different goals or different things they're dealing with, but that's not the forefront. I guess we try to look at who they are as an individual and what's going well with them, and before we start trying to think about what we might want to try to help them with.
Yeah.
Oh, I hear you.
Yeah.
I hear you. What are some of the common things that you find? What are some of the common issues that you find with your patients? What would be one of the more common issues?
It's probably like the most common thing is like they want to do something they love to do, but if they have like pain issue or something, then those things kind of hinder them to enjoy what they love. That's probably the biggest thing.
Yeah,
Because we don't really tell people like we're gonna help you to lose weight and stuff like that. So
Yeah, that's never really been our focus, kind of from day one. Like
Yeah.
we never really. There's people that do that very well, and it's great. The kind of angle approach that we took, probably from our own personal history, myself particularly. You know, I had different pain issues and things, non-contact injuries and pain and stuff that I had to sort out so that I could do the activities I like. So it made sense when I started working and coaching with people that those were the type of people I was helping, right? So I didn't come from a thing of like body transformation type stuff, because that wasn't something I personally experienced. I personally experienced dealing with, you know, unwanted, you know, pain and different things that were preventing me from doing whatever I wanted. So that when I figured out how to sort that kind of stuff out, then it was easy. I shouldn't say easy, but that was the kind of the path for what we were working with people. So when people come into our place, it's kind of, we kind of generally go in kind of two big buckets. It's like, one is people that are just in general trying to improve how they're feeling and, you know, how they're moving, so they can just in general enjoy their life more. And then we also have people that kind of want the same thing, but maybe they're a little bit more sports specific. Like they're like,
or performance.
yeah, meaning like they're, you know, they like to ski pretty recreationally a lot, or they like to play tennis a lot or something. So
We do have a lot of like people who plays basketball. as
yeah,
well.
yeah.
Oh,
So there's a
really?
lot- yeah. So the guy who currently works for us, he played some ball in college and in Japan, and so he's recently been kind of building up a pretty serious clientele base for people that are interested in playing basketball and that sort of thing.
Okay. Supplements versus natural food.
Yeah.
How do you feel about those? Do you think supplements, do you agree with them, or do you think they're necessary, or?
We do take some supplements, but we prior to that though, we try to eat balanced natural food. Yeah.
What do you think
What-
about, go on.
Yeah, well, I mean, one of the greatest analogies I heard about that was years ago by a gentleman by the name of Paul Chek that I studied with back a decade or so ago, and he had this kind of picture as like, you know, showing someone like building a boat or something, and you know, and hammering in the nails or rivets or something like that in the planks building the boat. And it's like, well, the supplements are kind of like maybe little nails or something like that. But it's like, if your planks, if everything you're putting the boat together with is like rotten wood, it doesn't really matter, So it's like, that's kind of the thing was like the food is like, that's the main thing. Like, when you're going to go build a boat, you start, you get the good planks and the good, whatever the other, for it's metal or something like that. You're getting all that together well, and then what you're kind of, you can put in little things to reinforce it, basically. It's like supplements are things to kind of reinforce stuff, but your base level nutrition is going to be, important. So, if you're eating like living off McDonald's and things like that, and then you're thinking like, oh, well, I'm going to take a multivitamin. It's like, well, yeah, but, maybe change the McDonald's first before you start worrying about the supplements and things.
What would you consider to be a bad client or patient? Someone who's difficult. What makes a client difficult?
The difficult people to deal with, right? So people who are not aware of what they're doing, or like they just don't have that awareness, right?
You have people like that? I mean, how would you know they're not aware?
They're not aware of like things that they're doing something not exactly optimal, but like they think they know everything.
Then why do they come to you?
Yeah, I don't know.
Yeah.
But they do, just to confirm. They want to.
It's just to confirm like they're doing the right thing or they know everything.
I don't know. Yeah, I guess the way I'd frame it as someone who's maybe really not in a position to be coached, right?
Yeah,
like they don't really have that mindset yet. And so I think sometimes people, they think that things are going to be just kind of a quick fix, or they think they want to just pop in, and it's just like, I guess that for me it's the hardest one. So people that they come in and they don't realize that it's like, or more of like a guide rather than like a technician that's just going to fix something. It's not like you take your bicycle to the shop. The guy's like, right, tightens this, tunes your, wheels or whatever, spokes and things like that. Okay, here you go. Human beings aren't like that. You can't just like go in and, mechanic them up kind of thing. But some people, they come in kind of thinking like that. They'll walk in and it's like, okay, yeah, my knee hurts, fix it kind of thing. And I'm like, well, it hurts because maybe of a lot of different things going on. And let's kind of talk about these things and like try to sort out kind of what's going on and things that they, probably might want to consider doing or different things like that. But a lot of it is on them. It's like it's on them. Like I can guide them and say like, yeah, you might want to do this, 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 this. But if they're not willing to be guided and they just think that I'm just going to, just give them like a single exercise or, rub something and they're going to be fine. It's like, that's probably for me the challenging one. Yeah.
Okay.
People just kind of wanting to be fixed like passively and not really willing to be coached and put in the work themselves and be guided to something.
So what do you do with someone like that? I'd get to that point.
Yeah.
When you have that person that just, like you said, knows it all, not willing to change anything, but wants you to fix them, how do you handle that?
I think it's just case by case, right? It just depends on like, it just depends on who they are. But the thing is like we need to learn who they are, and then we need to listen to what kind of language they are using. So just try to get the hint from that. So pay attention to what they're saying and listen to them more, probably.
Have you ever had to recommend them to someone else, maybe, or to another?
Yeah.
Like maybe you need to go to the hospital, get your checkup first, or.
Yeah, I've done that. I mean, I've referred people out where I thought that they would be, maybe a better fit with someone else, But like Kaori said, that's why it's so fundamental to get to know the person first, because I think that, we've had less of those issues when I started interacting with the person more as an individual and got to know them first. Before, like I used to be like they'd walk in like, okay, right, you're here because this is this. Okay, stand over here, do this, lift this, check this, and it just becomes this. And then I get them like, okay, well, it's probably this. You got to do these 5 things. You do this, and so. But I don't really know them. I like, it's like I should know. Like, do they have a dog? Do they have? What's their favorite movie? Like, what do you like to do? Do you have kids? What's your favorite thing to do with your kids? Like, all these things to understand them as a human being, and then it's much easier to relate to them. Be like, okay, so maybe let's think about this and this, and creating that relationship first. I think has made it so. At least personally, Kaori mentioned it's less of like these kind of problem issues. But it's mostly because we changed our approach, or I changed my approach, and got to know them better, and then could have a better conversation with them, and then they're more interested to learn, okay, and be kind of guided and coached, and start taking more of an active role on their side.
Right.
Oh, that's interesting, because I would really like that if I were going to go into someone. Everyone feels comfortable if they feel you know them a little bit better.
Right.
How many people come in that you know don't know themselves? Because that's similar to the issue you said, the know-it-all.
Yeah.
In a way, I guess that's saying they don't know themselves. They think they know, but they don't know. That's almost the same thing.
Yeah.
Do you ever have anyone come in that says, look, I really don't know, but I feel like this and this and this and this. What should I do? Do you ever have anything like that where a person comes in and they're really confused about what's happening with their bodies?
Yeah. So like, not maybe like what's happening about their bodies, but like some people come in without having any specific goals, right? So like if you ask them like, what's your goal? Like what would you like to achieve? Then I don't know. Just I was just told like to work out, just or something, right? But with that case, like we just keep asking questions
until you help them find
just
their
to
goal.
kind of peel the skin just one piece at a time.
Like peeling an onion.
That's right. Do you find something they can resonate with?
Right. Yeah.
That's interesting.
Yeah, because that's one, I think there's a lot of, it gets a little vague in general with the sense of, like terms like exercise. Like people hear that, like, oh, my doctor told me I'm supposed to exercise. Or I read, everyone says you're supposed to exercise. Well, it's like, but they don't really know what that means. And honestly, I don't know what that means. It's so vague. Like exercise, like what is that? Okay, we can go for a swim for 20 minutes. You can do some kickboxing. You can lift weights, or you can go horseback riding. It's all exercise, but is that meaningful to this person? And is it really actually what they need? And it's going to be something that they're going to enjoy and continue doing. And why are they really doing it? Are we exercising because we need to build up better cardiorespiratory capacity for them? Maybe. Or are we doing it because they have problems with movement? Their overall their motor control is off, and it's creating some issues and undue stress in certain joints and things like that. Or they have strength issues in some place. There's so many different things that can be addressed with exercise. So that's kind of one of the first things, is just like, let's kind of clear this out and get real specific on who they are, and what they're about,
and what they really want.
And what's necessary for them as an individual.
The two of you have been together for quite a while now. What would you consider, this is a question I'm starting to pose to everyone on my podcast, what would you consider a good life in Japan?
To be with this guy.
There you go.
Thank you.
I like that.
I'd say, I mean, our life, more and more I feel like our life is pretty good as it is. A good life is, I mean, not lacking anything, feeling content, and being grateful for what we have. And, in Japan in particular, it's like the kind of stability that's here and things like that. Sometimes I think, you look at other parts of the world and you don't realize like how nice it is to just be like, not have to worry about a lot of nonsense. You can go outside, you can get your food, come home safe.
You don't have to worry about shooting.
Yeah, no one's going to shoot you. You're not really, worrying about different things. It's like, I don't know.
Yeah, life here is pretty good.
I think a good life is just just being with people that you care about, and being content, and being able to help out here and there where you can.
I like that. Well, thank you so much again for being a part of this. Can we do it again sometime?
Yeah.
Yes, we can.
All right, good. That's what I want to hear. Thank you so much.
Thank you.
Thank you so much.
Thank you, Lance.
Thank you.
I want to thank all of you for watching this podcast. Make sure you press like and subscribe. And remember, it's all on loan. So continue to reach for the stars, because you're too blessed to be stressed.